If you're dealing with tingling or burning pain in your feet and hands, I have good news for you. Research shows you can reduce your risk of nerve damage by up to 60%. And in many cases, you can even reverse some of the damage that's already happened by taking simple steps, starting today. If you're looking for natural ways to heal damaged nerves and escape that persistent tingling and pain, you're in the right place. Most people believe that nerve damage, also called peripheral neuropathy, is a permanent condition that can't be reversed. Your doctor prescribes strong pain medications, and you accept that you'll have to live with these symptoms for the rest of your life. But the latest medical research tells a completely different story. In many cases, nerve damage can be reversed or significantly improved if you identify the root cause and provide your body with the essential nutrients your nerves need to repair themselves. Today, I'm going to share scientifically proven vitamins and supplements that can heal damaged nerves, including exact dosages and the best food sources for these nutrients. You'll also learn about hidden causes, including common medications you might be taking every day that could be silently destroying your nerves. And at the end of this video, I'll reveal a simple strategy that can reduce your risk of nerve damage by up to 60%. This number comes from a major clinical study that many doctors never even mention to their patients. Let's start with the single most powerful thing you can do if you have diabetes or prediabetes. Tight blood sugar control is the most important way to prevent and slow down the progression of neuropathy. The DCCT study, which stands for Diabetes Control and Complications Trial, and is one of the largest diabetes studies ever conducted, proved that good blood sugar control can reduce the risk of neuropathy by up to 60%. Think about that number for a moment, 60%. The A1C test, also called hemoglobin A1C, measures your average blood sugar over the past 2 to 3 months. The recommended A1C target for most adults is below 7%. This means you have the power to control your nerve health starting today, not with expensive medications, but by managing your blood sugar through diet, physical activity, and close monitoring. Diabetes is the #1 cause of neuropathy. Prolonged high blood sugar damages nerves throughout your body, especially in your feet and hands. The DCCT study followed thousands of people with diabetes for many years and discovered this remarkable finding. Good blood sugar control reduces neuropathy risk by 60%. The A1C test gives you a long-term picture of your control. You can achieve an A1C below 7% by eating fewer refined carbohydrates, increasing physical activity, monitoring your blood sugar regularly, and working with your doctor to adjust medications if needed. When you control your blood sugar well, you're not just managing diabetes. You're actively protecting your ability to feel, your ability to walk, and your independence in the years ahead. That 60% reduction means you're not powerless against nerve damage. You have control. Every food choice you make, every daily walk you take, every time you check your blood sugar, all of these are protecting your nerves. This is how you maintain your independence, continue doing what you love, and avoid becoming a burden to your family. But here's what most people don't realize. Even if you don't have diabetes, things you're doing every day, including medications you're taking, could be silently destroying your nerves without you even knowing it. Many people suffer from neuropathy, but don't know the true cause. Here are the hidden culprits. First, vitamin B deficiency, especially B12, B6, and B9, which is folic acid. These are essential for nerve health and common in vegetarians, vegans, or older adults. Second, common medications you might be taking right now. Omeprazole for stomach acid or reflux reduces vitamin B12 absorption. Metformin for diabetes also reduces B12 absorption. Some antibiotics like metronidazole, the tuberculosis drug isoniazid, certain HIV medications, and chemotherapy drugs can all cause nerve damage. Third, alcohol. Heavy regular drinking directly destroys nerves and blocks vitamin absorption. Fourth, infections. Shingles, which is herpes zoster, HIV, Lyme disease, and hepatitis C can attack your nerves. And fifth, autoimmune diseases like rheumatoid arthritis, lupus, and vasculitis can cause inflammation and nerve damage. Check your medicine cabinet right now. If you're taking omeprazole for acid reflux or metformin for diabetes, you need to know that these medications reduce vitamin B12 absorption, which is essential for your nerves. This doesn't mean you should stop your medication, but you need to supplement with B12 to compensate. Similarly, if you're being treated for an infection or tuberculosis, ask your doctor about monitoring your nerve health. And if you drink alcohol regularly, even just a glass or two every night, it might be time to consider cutting back to protect your nerves. Understanding the cause is the first step to taking control. Once you know what's causing harm, you can eliminate or minimize it. Don't let a common medication or daily habit silently steal the feeling in your feet, make you lose your balance, or prevent you from holding your morning coffee cup. Quick question. Are you currently taking any of the medications I just mentioned? Type number 1 if yes, number 2 if you're not sure, or number 3 if no. This helps me understand our community better and create content that's most relevant to you. When you identify the hidden cause attacking your nerves, you take back control. You're no longer suffering helplessly. Now let's talk about what can actually heal your nerves. These are the vitamins and supplements you truly need. There are 3 key nutrients that have been scientifically proven to repair and protect your nerves. First is Alpha Lipoic Acid, or ALA. This is a powerful antioxidant. Research shows that 600 milligrams per day helps reduce inflammation, improves nerve conduction, decreases pain and tingling, and supports blood sugar control. You can find ALA in red meat, liver, broccoli, and spinach, or you can take it as a supplement at 600 milligrams daily. Take it in the morning with food for best absorption. Second is the B vitamin complex, especially B12, B6, and B9. These are the fuel for your nervous system. B12 helps regenerate the myelin sheath that protects your nerves. B6 supports nerve signal transmission. And B9, which is folic acid, participates in producing new nerve cells. Food sources include red meat, chicken, salmon, eggs, dairy products, and fortified cereals. If you're over 50, vegetarian, or taking metformin or omeprazole, you must supplement with B12. Take at least 500 to 1,000 micrograms daily. Look for a B complex that contains at least 500 micrograms of B12, 50 milligrams of B6, and 400 micrograms of folic acid. Third is magnesium. This is an essential mineral for nerve function and electrical signal transmission. Magnesium deficiency causes muscle cramps, tingling, and worsens nerve pain. Many people over 50 are deficient in magnesium because absorption decreases with age. They're taking diuretic medications, or their diet is low in magnesium. Rich sources include dark leafy greens like spinach and kale, pumpkin seeds, almonds, black beans, and salmon. For supplementation, take 300 to 400 milligrams of magnesium glycinate or citrate daily. These forms absorb well and don't cause diarrhea. Take magnesium in the evening because it can help reduce nighttime muscle cramps. Your nerves need specific nutrients to repair themselves. Without these nutrients, your nerves can't regenerate the protective myelin layer or conduct signals properly. Start with Alpha Lipoic Acid at 600 milligrams each morning with a meal. Then add a B complex vitamin. Look for one with at least 500 micrograms of B12, 50 milligrams of B6, and 400 micrograms of folic acid. Add magnesium at 300 to 400 milligrams in the evening to help with nighttime cramps. For food, eat salmon or red meat at least 3 times per week. Add a handful of pumpkin seeds or almonds as a daily snack, and cook with dark leafy greens regularly. These aren't magic pills that work overnight, but within 4 to 12 weeks, many people start noticing a difference. Pain gradually decreases, tingling becomes less frequent, feeling returns to your feet, and sleep improves because pain no longer wakes you up. And most importantly, you're stopping further damage and helping your nerves heal themselves. When you give your nerves what they need, you're investing in your ability to feel your feet when you walk, hold a coffee cup without shaking, and sleep through the night without pain waking you up. These simple things are incredibly valuable for your independence. Beyond these three essential nutrients, there are some additional natural supplements that research is exploring. They may not be required, but they're definitely worth considering. First is omega-3 from fish oil. This has powerful anti-inflammatory properties and supports overall nerve health. Preliminary research suggests omega-3 may help reduce inflammation related to nerve damage. The best sources are salmon, mackerel, sardines, and herring. For supplementation, take 1,000 to 2,000 milligrams of EPA plus DHA daily. Choose high-quality fish oil that's been tested for purity. Second is curcumin from turmeric. This has strong anti-inflammatory and antioxidant properties and may help protect nerves from oxidative stress. Research is ongoing to explore its role in nerve health. The easiest and cheapest way to get curcumin is to add half a teaspoon of turmeric to your food daily. You can also take curcumin supplements at 500 to 1,000 milligrams with biopyrine, which is black pepper extract, to increase absorption. Third are N-acetylcysteine, or NAC, and acetyl L-carnitine. These are amino acids with antioxidant properties. Preliminary research suggests they may support nerve health, though more studies are needed. For NAC, take 600 milligrams twice daily. For acetyl L-carnitine, take 500 to 1,000 milligrams twice daily. Consult your doctor before taking these because they can interact with certain medications. Think of these supplements as extra protection for your nerves. Your foundation is ALA, B complex, and magnesium. These additional supplements are extras, not required, but they may enhance your overall results. Start with omega-3 if you don't eat much fish. Adding turmeric to your meals is the easiest and most affordable way to get benefits. For NAC and acetyl L-carnitine, talk to your doctor first about appropriate dosing and potential interactions. If you're still watching and finding this information helpful, type yes below. This lets me know this content matters to you, and every comment motivates me to keep sharing health knowledge like this. By combining these supplements with the three essential nutrients, you're building a comprehensive program to give your nerves every chance to recover as fully as possible. Now that you know what to add, let's understand exactly what's happening inside your body when your nerves are damaged. Peripheral neuropathy is nerve damage that develops from harm to your peripheral nervous system. The peripheral nervous system is the vast network of nerve cables that connects your brain and spinal cord to the rest of your body. These nerve cables have a protective layer called myelin. Think of it like the insulation coating around electrical wires. Myelin allows electrical signals to transmit quickly and accurately. It also protects and insulates the nerves. When the myelin layer gets damaged from high blood sugar, vitamin deficiencies, alcohol, or other causes, nerve signals get interrupted or transmitted incorrectly. That's when you feel burning pain, tingling, or complete loss of sensation. To understand how to heal your nerves, you need to understand how they work and what went wrong. Your peripheral nervous system is like your body's electrical system. When myelin gets damaged, the signals short-circuit, causing pain, tingling, or muscle weakness. The good news is this. Unlike many other types of cells, nerves have the ability to regenerate myelin if you remove the cause of harm and provide the right nutrients. Understanding this mechanism helps you not feel powerless. Your nerves aren't completely dead in most cases. They're injured and calling for help. When you respond with the right steps, they can recover. When you understand your condition, you no longer feel confused or afraid. You know exactly what you're fighting and how to win. Finally, let's talk about medical treatment options, because sometimes you need to combine natural approaches with modern medicine for the best results. The foundation of neuropathy treatment is identifying and eliminating the cause. Control blood sugar if you have diabetes, stop or reduce alcohol consumption, and adjust harmful medications with your doctor's help. For pain relief, there are several medication options. Anti-inflammatory drugs, also called NSAIDs, like ibuprofen and naproxen, can help, but these should be used short-term under medical supervision to avoid side effects. Nerve pain medications like gabapentin and pregabalin work differently than regular pain relievers and can be much more effective. Antidepressants like amitriptyline and duloxetine are also effective for nerve pain, even if you're not depressed, because they work on pain pathways in your brain. Topical treatments like lidocaine patches or creams can provide localized relief, and physical therapy and rehabilitation can improve muscle strength, balance, and pain while enhancing your overall quality of life. Vitamins and supplements are your foundation, but sometimes you need additional medical support, and that's completely normal. If your pain is severe, talk to your doctor about nerve pain medications like gabapentin. These work differently than regular pain relievers and can be much more effective for nerve pain specifically. Physical therapy isn't just about exercise. Specialists can teach you specific exercises to improve balance, prevent falls, and maintain mobility. Therapies like TENS, which is transcutaneous electrical nerve stimulation, can also help reduce pain without medications. Don't think that needing medication or therapy is a failure. The goal is for you to live comfortably, independently, and do the things you love. If modern medicine combined with natural approaches gives you that, then that's the right path for you. When you combine medical treatment with proper nutrition, you're using every tool available to reclaim a pain-free life, so you can keep playing with your grandchildren, take your morning walks, or simply sleep through the night without pain waking you up. As we've explored today, nerve damage is not a life sentence. From blood sugar control that reduces risk by 60% to essential vitamins like Alpha Lipoic Acid, B-complex, and Magnesium, you have powerful tools to heal your nerves. Now it's your turn. Which vitamin or supplement on this list surprised you the most? Let me know in the comments below. If this information could help someone you care about, please share this video with them. Hit the like button to help others find these important solutions. And subscribe with notifications on so you don't miss our upcoming health content. I believe your body has an extraordinary ability to heal itself if you provide what it needs and remove what causes harm. We've prepared more videos on optimizing nerve health and controlling blood sugar naturally. Check the description below to watch. As always, discuss with your doctor before starting any new supplements. Thank you for watching, and here's to your health.